This afternoon, Kansas state health officials are investigating the death of a 68-year-old woman from Effingham, Kansas. Her obituary says she died after complications from a COVID-19 vaccine. Investigative reporter Matt Fleener is live now at the Jefferson County, Kansas Health Department in Oskaloosa. Matt?
Yeah, Kelly, we've been working all day to learn more about this death of that woman who attended a vaccine clinic sponsored by the Jefferson County Health Department on Tuesday. At the Main Street Food and Fuel in Effingham, Kansas, a sign on the door says we're saddened by the untimely death of Jeannie Evans. The owner respectfully did not want to speak about his former co-worker, but knew of what happened. EMS dispatch records say a 68-year-old woman had an allergic reaction at a public health vaccination hosted at the Keystone School in Ozaukee. Evans' obituary says she died Wednesday from a reaction to the COVID vaccine. In a statement, the Kansas State Health Department says a 68-year-old started experiencing anaphylaxis but did not identify Evans. Also saying until the investigation is complete, it is premature to assign a specific cause of death. Doctors at the University of Kansas Hospital on Thursday heard about what happened.
I'd want to know very clearly in my mind before somebody said they died of the vaccine that in fact that happened to that person after they were vaccinated was uniquely due to that vaccination and nothing else.
Meanwhile, the sign on the door back in Effingham says we will miss her greatly. And the door here at the Jefferson County Health Department is actually locked. We've been calling and emailing all day, trying to find out the specific brand of the vaccine this woman received. Also, we've been reaching out to the state to find out that information. We're still waiting to hear back. Matt Fleener, KMBC 9 News.
Now, the CDC says 126 million doses of COVID-19 vaccines have been given. That's through March 22nd. There are 2,216 reports of death among people who've received a vaccine. That represents 0.0018 of the total. The CDC says as of now, there is no evidence vaccination contributed to the patient deaths. New data from AstraZeneca shows its COVID-19 vaccine is 76% effective in preventing symptomatic disease. The drug maker says it's also 100% effective in preventing the need for hospitalization. Now, these numbers aren't drastically different from the data released Monday. On Tuesday, though, an independent board said it believes some of the data AstraZeneca included in that report was outdated. That led the drug company to modify its efficacy data. AstraZeneca is expected to apply for emergency use authorization next month. Soon, you might be able to get a vaccination shot at your doctor's office in Kansas. KMBC 9's Michael Mahoney says that's part of a developing plan.
Doctors' offices in Kansas are not a major part of the state's vaccination process yet.
So if you had a physician practice, get signed up. They've got 5 doctors that they practice with. You could see where the juice is definitely worth the squeeze.
Nielsen is Kansas Governor Laura Kelly's chief advisor on the pandemic. The Kansas Medical Society likes it too.
We believe physicians are important both from the medical aspect and towards getting the population a lot more comfortable with the vaccine that has now come out.
Doctors' office vaccinations would not dramatically increase the numbers. They just don't see that many people a day. But it might affect some doctors' patients who are skeptical or who have complicated situations.
They might want to go and visit with their physician first. Maybe they don't think that it's, or maybe they're the opposite end of the spectrum, really healthy and just not sure that that's something that they need. They didn't get COVID.
Now we're saying to doctors, listen, we're going to equip you with vaccine for your own patients. Please get signed up. And we're trying to make that as simple as possible.
Vaccines do 2 things. They protect one person and they protect collectively a herd of people. Adding Kansas doctors' offices might be part of that process. Michael Mahoney, KMBC 9 News.
Now, Nielsen's office says it's still working on the plan. She thinks the single-shot Johnson & Johnson vaccine would be ideal for doctors' office shots. New cases in Missouri are going down. The state's 7-day rolling average is now at 517 compared to a week ago. We'll get an update from Kansas tomorrow. In Kansas, the monthly positivity rate is 2.8%. In Missouri, the positivity rate is at 4%. Johnson County, Kansas is extending its COVID public health order through the end of April. The order requires social distancing and wearing masks indoors and outside when a 6-foot distance is not maintained. The order removes the limit on public gatherings. In Kansas City, Missouri's COVID-19 emergency order goes through May 1st. Restaurants, bars, and taverns can resume permitted operating hours. There is no longer a limit on gathering size, but everyone at those gatherings must follow masking and social distancing guidelines. Masks should be worn at all indoor spaces and also outdoors when physical distancing cannot be maintained.